start with question number one. Do you evaluate MD candidates and DO candidates separately?
Well, thank you, Dr. Sagunro, for having me. It's really a pleasure to be here. And as you said, I'm really a stand for excellent medical education for all of our graduates. We do give some preference to our osteopathic graduates since it is harder for them to compete in some of our institutions as far as their surgical residencies are concerned.
And what are some of the scores of each of those exams that you would find competitive for your program?
Currently, we look at osteopathic applicants that have to have at least a 580, but we generally prefer 600 on step two. For USMLE, we will consider applicants above 240.
Are there specific things that you want to see in a candidate's application in ARIS? Are there certain things that make candidates stand out to you?
Yeah, I would say within the application, obviously, there's many things that the application encompasses. I would say, at least from my perspective, the things that I look at, I look at grades from medical school. I look at their board scores. I pay a lot of attention to their personal statement because I think that's the one thing that comes through the most in terms of who this person is and will they be a good fit in our program. Letters of recommendation. And then also how the applicant sort of describes their most meaningful experiences.
So I appreciate being included in this. To answer your question, I would say, like you mentioned earlier, our program has osteopathic recognition. There are 5 general surgery residency programs in the United States who have that. That basically means that our curricula includes extracurricula, just like all of our osteopathic students get in medical school. A lot of what that paper covered, we looked at USMLE, we looked at fourth year rotations. There were a number of things that we looked at in that paper that we talked about today. I hope one day we get to a place where people and programs accept COMLEX, and because it's a good test.
If you had to give three top things from a program director's standpoint to wrap it up and sum it all up, what would they be? What would the three pieces of advice be?
Number one, you have to have a step two score. That's impressive. That's just the way it is. Extra ticket to the interview.
I would say authentic, like authenticity, optimistic.
I would say probably hardworking. So good work ethic, hardworking, team oriented.
The reason why it's so hard to get into medical school, so hard to get into residency, because doing this job is a hard job. We have to be good at this so we can be good for our patients. The reason why it's hard to do this is because it's a privilege to do it.